கோவை மேல் நேயர்களுக்கு இனிய வணக்கங்கள். நம்மளுடைய கோவை கொரோனாவினுடைய பிடியிலிருந்து மீண்டு பச்சை மண்டலமாக மெதுவாக மாறி வருகிறது. முழுமையாக அந்த நிலையை அடையும் நாள் அருகாமையில் இருக்கும் இந்த நேரத்தில் தனியார் மருத்துவமனைகளில் கொரோனாவிற்கான சிகிச்சை அளித்ததில் PSG மருத்துவமனையினுடைய பங்கு மிக பெரிது. அவர்கள் சந்தித்த சவால்களும் சில இருக்கும் இந்த நேரத்தில். அதை பற்றியெல்லாம் நம்மளிடம் கூறுவதற்கு Dr.J.S.Bhuvaneswaran மெடிக்கல் டைரக்டர் ஆஃப் PSG Super Speciality Hospital அவர்கள் இணைந்திருக்கிறார். வாங்க பார்க்கலாம்.
I am here to share some of my views about the current ongoing corona or the COVID-19 infection. In my own way, I look at it as four phases. The first phase is before we really had the infection, what we thought about it. The second phase is what I would say that what we are going through now. We are going through the infection. The third phase is the peak and the descending phase. We really don't know whether we have reached the peak and whether we are in the descending phase. If it comes, it will be the phase 3. Phase 4 is post-corona, that is after the corona pandemic is sort of well under control or it goes off, then what happens? No, this is exactly the way I look at it. Central government and state government went on for a strict lockdown. That's the time we really became more organized and more planned. We formed a COVID task force which had about 6 consultants, and these doctors with the guidance of the dean of our medical college, what we did is to plan the total strategies of how to approach this problem. Then we made a modification. We made a decision of 2 separate blocks, one for the corona, one for the non-corona. Then we had very clear-cut drawn policies, and government of Tamil Nadu and the healthcare department recognized us as one of the hospitals, and we have almost treated around 40 to 45 patients of corona positive patients in our hospital. All that was possible because of the dedicated support of our doctors, intensivists, the physicians, the nurses, attenders, sanitary workers, security, all that. So we currently had, as I told you, have the experience of having treated a good number of patients other than the ESI hospital in Coimbatore, and by God's grace we have not lost anybody. All the patients made it. Few of them were very sick, but slowly they were also rallied around. Still we have limited only for essential emergency surgeries. We are not opened up the regular surgeries. So overall, as far as the healthcare facility is concerned, we have taken all the precautions till date to maintain the social distancing, to maintain the proper sanitary measures of hand washings, and to make sure that the visitors policy, all that is happened. So in Coimbatore level, as you know that Coimbatore, the corporation, especially a special mention I should say about the collector of Coimbatore, who has done an excellent work in terms of they are always in touch with us. And again, we had the great privilege of treating about 6 police personnel who were admitted with us, who were very discharged in a very healthier state. So this is the what I want to tell as currently what has happened here in our healthcare scenario. When we wanted to start the sanitary measures, we started with the hand rub, then we went on to other things, like we had a disinfection tunnel, we have the hand washing. Still, we face still a lot of resistance from the patients and attenders. When we say that we have to triage them, they have to come in proper line, maintain the social distancing, and we will not allow attenders inside. All this we still have resistance. Actually, if you look at it, currently in government of India or in our overall number of cases in India, we are getting around 4,000 to 5,000 cases every day. In fact, if you see next to US, next to Russia, 2-3 countries, India is in the first top 7 in terms of number of new cases, high number of new cases. That is worrisome still. But interestingly, what we have observed, except in some pockets, overall, although the patients' positivity number is high, patients are not very sick. For example, if you take Chennai, every day Chennai is getting around 300 to 400 patients. But because we have connection with our doctors there, when we talk to them, out of 400, almost you say 390 people are fine, there is no problem. Only about 5-10 people have some issues. They are also not very sick. So that means, although the number of positives are high, we are seeing not many sick patients. And over these 3 months, this has given us a lot of confidence. So we feel that we will be able to manage by quarantining, social distancing, and the requirement, as people thought, like too much of ventilation, too much, those type of things, we have not seen yet. So if you see the overall trend, we seem to be still in the ascending phase. Probably we will have a plateauing in this month. This is exactly what we are looking at it. Number 2, the second wave worry is very much there. In fact, if you take Tamil Nadu focused, see, we relaxed our lockdown from somewhere in 4th of May. And from Monday, that is from yesterday, there was some more relaxation. And 17th, even the buses are going to be over. So if all this happen, we should see the second wave can be expected somewhere in the last week of May or first week of June. If the second wave also shows only number of positive cases increase, no sick patients, then I think our chances of confidence and almost going back to normalcy is very high. So currently we make sure that all the patients who are coming to the hospital, we have created a separate fever OP, which is there in the block B. So everybody whom we suspect any fever symptoms, respiratory symptoms, they are directed, we take them in a battery car to the fever clinic, and from there those protocols are taken care by that block. Otherwise, all others, we screen them for temperature, oxygen saturation, then they are allowed to the registration department. Only patient is allowed. Very sick patients, we allow one attender, otherwise we restrict the attenders. And currently, that is exactly how OP is managed. All the doctors in the OP, they use the N95 mask. We are not allowing anybody to be in the outpatient areas without mask. And we maintain, even our chairs, if you see, we maintain social distancing. And so this is a very well planned operation. And as you know, PSG, we have a large infrastructure. So we are able to really maintain that well. And for the corona block, in fact, what we are doing now, the doctors, staff nurses who are working in corona block, they are made to stay in a hostel. So for 1 week they work, after which they are shifted to the second hostel called as quarantine hostel. So they stay there for another 1 week to 14 days, and then from there they come into the mainstream. So it's a very well organized rotation. And so we, as till date on, we don't see, we don't encourage regular OPs. We are still seeing only people on appointment requiring with some sickness which needs immediate attention. And one more additional thing, we have opened up our telemedicine also. So we have now, we offer consultations through our telemedicine platform, and we are going for a total complete model of telemedicine within very shortly. So these are all the certain changes which we have done currently and which is ongoing.
One question, sir. The public's role in flattening the curve.
In fact, in fact, I was a little worried, like once the lockdown is over, because till lockdown, definitely, except occasional, we were not seeing vehicles, we were not seeing especially the two-wheelers, people going out. But now what we are seeing is a little worrisome, because especially in many places, the common areas, the social distancing consciousness is coming down, I feel. People are not maintaining the social distancing. I think, as you say that, I think the fear element has come down. People think that probably we may not have the issue. And number 2 is especially the hand washing also, I see a significant reduction in the number of people having the hand washing and the sanitary measures. 3, still people continue to venture out unnecessarily. So I want to tell I don't think we are come out of corona even now. So if we have to still definitely maintain the social distancing, proper sanitary measures like hand sanitizing and usage of masks. And the third point is to unnecessarily avoid going to the outside places, venturing out. That should come down. So only essentially people who need should come out, otherwise they should not come out unnecessarily. And as I told you, if the second peak, if it's going to be in June and if it's going to be high, then we don't know how the things will, whether the government will go back on measures. So we pray that those things may be avoided only if the people do not unnecessarily mix and spread the problem. Because as I was telling, many of the people who get the infection appears to be asymptomatic. But problem is, once these people who have less symptoms, if they move with vulnerable people like old age people or cancer patients or people with uncontrolled diabetes, the chances of them infecting the vulnerable people is high. So that is most important. So we should avoid unnecessarily. So this is my humble opinion and suggestion.